Greetings from the South Dakota Physical Therapy Association Spring Conference, where I'm working with a fantastic group of physical therapists. The topic just came up. What are some really good bullet points to cover with physicians and nurses on the oncology side when talking about promoting cancer rehab referrals? Here are my non-traditional bullet points. The opportunity to present the value, benefit, and role of rehabilitation in cancer care to oncology nurses and doctors is one that we typically jump at. And when doing so, we usually hit the bullet points of how rehab decreases pain, decreases fatigue, improves mobility, range of motion, and quality of life for patients. But when I get peppered with questions by these doctors and nurses, they don't always match up with what I think they're going to ask. I'm cancer rehab specialist Dr. Leslie Walke. I have done tons of these talks all over the United States, and here are my non-traditional tips for talking with cancer doctors and nurses. Yes, of course, hit the highlights on the benefits of rehab, but definitely include: number one, start with that all patients with cancer should get a rehab consult versus all patients should get rehab. Some patients with cancer may not need rehab, some will. Some will need only a little bit, some will need a lot of rehab. Physicians and nurses need to get all patients to us so we can assess and evaluate if the patient needs rehab, and if they do, how much. They will not get more rehab than they need. Number two, yes, we care about patient costs. Yes, rehab is covered by insurance. Copay and deductible costs should be discussed with the patients before we start. However, point out that with the onset of surgery, chemo, and radiation, patient copays and deductibles are usually already taken care of. And when it comes to rehab costs, you can get a good course of multi-visit cancer rehab for less than the cost of one shot of Neulasta. Cancer rehab is low risk, low cost, high value, evidence-based, and insurance reimbursed. Number three, no, patients are not too tired or too sick to come to rehab. Traditionally, cancellation and no-show rates for cancer rehab are less than our orthopedic counterparts. Compliance in cancer rehab is high, and patients typically feel better when they leave our clinics. Number four, cancer doctors and nurses are usually incredibly busy people. Make sure they know that sending you their patients will decrease their work, not increase it. Our job is to make their job easier. By keeping patients happier and healthier, we help minimize fall risk, improve ejection fraction, decrease hospital readmits and emergency department visits, and maximize the patient's performance status. 5, and finally, review how they should write a script or enter an order for rehab into the medical record. Thank you for continuing to advocate for your patients with cancer, as anyone diagnosed with cancer deserves access to a rehab consult. I'm Dr. Leslie Walke. Have a great day in the clinic.